My name is George Joseph, faculty from the Department of Physical Therapy from Yenepoya Physiotherapy College. Today we'll be talking about quite a vital topic in the physical therapy world, which is gait. By the end of today's session, we will learn about what exactly is gait, a little bit of gait cycle, pathological gait, and an overlook on types of pathological gait. Now, what exactly is gait? Gait is nothing but a rhythmic cyclic movement of limbs in relation to the trunk, resulting in forward propulsion of the body. This means nothing but how coordinated our trunk and our limbs work to get us forward in the body. Now, what is gait cycle? The full cycle begins when one foot makes contact with the ground and ends with the same foot contact on the ground again. Now, how does that work? It is nothing but when one foot is on the ground, with the same foot goes up in the air and comes back on the ground. That is one complete gait cycle. That is starting with one heel strike to the next heel strike of the same foot. Now, gait is usually divided into two phases, which is stance phase and swing phase. Now, stance phase is nothing but when the foot is on the ground. 60% of our gait cycle is when our foot is on the ground, that is stance phase. Now, swing phase is nothing but when the foot is off the ground, that is 40% of the gait cycle, the foot is off the ground and goes to the next stance phase. So, one stance, swing, that is the whole cycle of gait. Now, if you look at the pictorial representation put up now, you can see the first, from the left side, you can see the first 5 diagrams is nothing but in stance phase. The next 3 is swing phase. So, the stance phase is again sub-classified into 5 different sub-classification, and swing phase is again sub-classified into 3 other sub-classification, which we will be talking in brief. Now, stance phase, as I said, it's classified into sub-phases, which is initial contact, foot flat, mid stance, heel off and toe off. Initial contact or heel strike, it is nothing but the first contact of the foot or the heel on the ground to start off with the stance phase. Next is foot flat. Foot flat is nothing but when the whole foot is on the ground. All right. So, heel strike is when just the heel is on the ground. That is the start of our gait, the stance phase. Foot flat is when the foot is on the ground. All right. Next, we move on to mid stance. That is when the whole body weight is on the feet. Heel off, which is the 4th phase. That is when the heel is out of the foot, and toe off, that is when the whole foot is out, only the toe is in contact with the ground. So, let's rewind. Heel strike, that is when the heel is touching the floor. All right. Foot flat is when the foot is already on touching the floor. Mid stance is when the whole body weight is on the feet. Heel off is when the heel is out of the ground. Toe off is when the toe is about to leave, and then we follow it with the swing phase. All right. Now, coming to swing phase, so stance phase is over with 5 sub-classifications. Moving on to the swing phase is nothing but when the foot is above the ground or on the space or the air. Now, the swing phase is nothing but divided into 3 again sub-classification. One is acceleration, mid-swing and deceleration. Acceleration is when the toe off is done, you're bringing the foot from the back to the front. All right, that back initiation, that bringing it forward is acceleration. Mid-swing is when it crosses the body and comes forward, and terminal swing is when you're going to put the next heel strike or the next initiate the next stance phase. All right, that is what is in the slides which is shown. Deceleration is nothing but decelerating or decreasing the speed for going into the next stance phase. Now, what is pathological gait? That is another complete different topic which we will be discussing on. Pathological gait is nothing but a type of walking pattern which resulting from impaired strength, range of motion, pain or balance combined with mechanical compensation. Now, we're all human beings, right? We do not like sitting idly. We do not, even if we are in pain or even if we have some injury towards the leg or ankle or whatever it is, we don't tend to sit idly for long. We tend to, somehow find a way to get where we have to go, or find a way to go where we have to go. So this we tend to compensate on it. Say that we have an ankle sprain. Ankle sprain is nothing but twist in the ankle. So which again says to be, it brings in a lot of pain, and we tend to compensate with other body. How do we compensate? Say that if my right ankle is sprained, I don't put more weight on this leg and I don't spend more time on this leg. So I keep this leg and then I put my next leg forward. I can keep it, I suddenly keep the next leg forward. That's how I compensate. So this can be because of pain. It can be because of if my joint is not extending or flexing properly. It can be because of muscle tightness or weakness, a neurological involvement, or limb length discrepancy or deformity. Now we are going to overlook or briefly discuss on few of the pathological gait. Again, it's a huge umbrella. I've taken few up and then we'll be discussing on few of them. First is antalgic gait. Antalgic gait is nothing but, antalgia, the word antalgia is stay away from pain. So antalgic gait is nothing but a compensatory mechanism or a self-protection mechanism which is present so that you walk in a different way when there is pain. Again, as I said, when there's an ankle sprain, we tend to, we would not be putting more weight on the affected leg. We'll be putting more weight on the unaffected leg. We'll be moving forward. So we'll be limping. In other terms, we call it limping. This is nothing but to maximize, to minimize the pain, or to protect the injured area. So that is nothing but antalgic gait, usually when associated with pain towards the lower limb. Coming to scissoring gait. Scissoring gait is nothing but a representation of the blades of the scissor, which is our lower limb, mimics the blades of a scissor. That is scissoring gait. Now, how exactly does it work? So what happens is our adductor muscles are nothing but the muscles of the inside of our thigh. When those muscles become super tight, it tends to stick our thighs together with our knees, keeping it away. Keep sticking the knees together and legs away. So what happens is it becomes the blade of a scissor. So they tend to walk in such a pattern, if you can see the representation which is put on the slide. Usually seen with the patients with cerebral palsy. All right. Going to fascinating gait. Fascinating gait is usually seen for patients with Parkinson's disease. Now, what is Parkinson's disease? It's nothing but a neurodegenerative disorder where the dopamine levels come down. So they have all these characteristics where they'll be shivering, there will be tremors, they'll be having short steps. They tend to take very short steps. It's called short shuffling steps. They tend to slouch forward because they always have a thought or always have a fear of fall. So they tend to walk in such a way that they'll be bringing their shoulders forward, they'll be taking small steps, and they'll be shivering the whole time. That is nothing but, or the gait which comes with Parkinson's or later stage of Parkinson's is nothing but fascinating gait. Coming to quadriceps gait. Quadriceps gait is nothing but quadriceps muscle is a muscle which is present in the anterior aspect or the front of your thigh. So what happens is when there is weakness of paralysis in the quadriceps muscle, what happens is there's buckling of the knee. There's nothing but your knee does not extend or become straight in simple terms. So if the knee does not become straight, what happens is there is problem with your taking the next step. Your knees have to be straight to lift your leg going into swing phase. Yeah. So when the knee does not become straight, how do you compensate? So if you can see the picture, the patient tend to push their knee down, or it's also called as hand to knee gait. Push their knee down and then extend the knee and then bring to the next gait. So it's nothing but they'll be pushing their knee every time they take the next step to finish their stance phase. That is quadriceps gait. Moving on to high steppage gait. High steppage gait is usually seen when the dorsiflexors are weak. Say that this is the feet. The muscles which keeps the feet upright like this or brings the feet up are dorsiflexors. All right. Now, when the dorsiflexors are weak, what happens is your feet tends to fall or feet tends to be on the ground. It's called foot drop. Now, what happens is whenever you walk, this feet would be dragging because your dorsiflexors are not acting. You have to lift your leg and keep it to the next heel strike, right? Now, since you cannot do that, your foot would be dragging the whole way. So to prevent that, what the patient does? The patient lifts the leg and stamps on the feet. All right. So to prevent or to clear the feet for the next phase, next walking step, what he does is he lifts the leg which is above the normal range and then he stamps on the ground. So that is how he tends to walk, or to clear the ground, that is how he takes the next step. That is nothing but high stepping gait. Moving on to some other pathological gaits are short leg gait. That is nothing but a patient when there is limb length discrepancy. That is nothing but when one leg is bigger or one leg is smaller, they tend to compensate or walk in such a pattern. Ataxic gait is nothing but a gait which is associated with ataxia, coordination issue, where they'll be walking as if they're drunk. It's also called as drunken gait, full on coordination issues and balance and coordination, things like that. Stamping gait is when there is less sensation on the bottom side of your feet. There's lack of sensation or there's reduced sensation on the bottom side of the feet. So what happens is they tend to stamp their feet on the floor so that they get sensation or feel that they have put the next step. Hemiplegic gait is a gait which is associated with hemiplegia or stroke, where on the upper limb they'll have a flexus energy, they'll be keeping their hand like this, and the lower limb they'll be having weakness, so that they'll be doing a circle, or it's also called a circumdactory gait, where they'll be taking circles of the feet to finish the stance phase. They do not bring it forward, they take a circle, a semicircle from the sides, and they'll finish the gait. Going to waddling gait. Waddling gait is nothing but when their lower abdominal muscles are weak, you tend to waddle on either sides and you tend to walk. That is nothing but waddling gait. These are again some of the other pathological gaits. There are a few more. This is just put in together some of the most important pathological gaits. Moving on, so let's just brief on what we have learned till now. So we talked about gait, what exactly is gait, or what forward propulsion, what is gait. The cycles of gait, that is how do we move forward, that is, there is a stance phase. Let's brief on that, or let's talk on the stance phase, which is heel strike, foot flat, mid stance, heel off, toe off. There is a swing phase, that is acceleration, which is the leg in the back. Mid swing, it's crossing the body. Terminal swing, when the leg is in the front, which comes to the end of the swing phase. Now we talked about few of the pathological gait or the compensatory gait we do, which can be due to pain or a joint problem, or it can be due to a muscle stiffness or tightness, or it can be because of weakness, or it can be a neurological deficit. Anything to do, it can be congenital as well. So anything to do with that also we just spoke about. That's about it. These are my references and that's about it. Thank you.